Well, let's get back into the dental issue. And man, this kicked off yesterday when we covered and talked about it. So many calls, really high, what I call talkback volumes. And it has continued. I've had friends, I've had family talking about their trials and tribulations with dental care. I tried to book an appointment yesterday in Wellington to look at my teeth, which are in shocking shape. And apart from one on Thursday, it's like a month wait. I'll just read a few texts I've got through here. I have 3 daughters needing braces. I've paid for one so far at 13 grand. My mother couldn't afford it for me when I was a child, but refused to have mine go through the same thing, says Dave. This one, tried to book a dental appointment at Lumino Marston last week. No free appointments until next year. All dentists except one have left. Boy. Oh, by the way, Amos, friendly Amos, get in touch. Please send a email with your contact details to hello@theplatform.kiwi. And I'll get in touch, because if your uncle's got an apartment in Central Paris and he doesn't mind Lockie and Marty crashing, that'd be cool. Okay, so the question is, the Greens have said free dental care is part of their policy platform and it'll be paid for by a tax on the rich. Well, maybe that's an impractical policy, and of course, in truth, nothing's free. It's subsidised or government subsidised. But I think from the discussion we have had yesterday, there is a need in this country for more affordable dental care to be available. Why isn't it? Is there a structural problem with the industry? What is going on here? Well, let's talk to the people who do it. Let's talk to the New Zealand Dental Association and their CEO, Dr. Mo. Now, is it AMS or AIMS, Mo?
Kia ora, Sean.
Yeah. Can I call you Mo?
Absolutely.
All right, Mo. All right. I just want to start with this fundamental, see if we can agree on this. There is an issue of affordability and availability with dental care in New Zealand, yes or no?
Yes.
Okay. Does any other country have the same problem, or is this unique to New Zealand?
Other countries have it too.
Okay. What is the problem? What's causing the problem, Mo?
Well, dental care, Sean, is often people mistake it thinking it's quite simple. Dentists graduate with a bachelor's of dental surgery. The work we do is quite complex work. For us to be able to provide this level of complex dental treatment and surgery, we have to have clinics that are set up to such a high standard, undergo such rigorous compliance testing regularly, and for us as clinicians to uphold such regular standards of continuing professional development. That doesn't come cheap. It does cost a lot of money to set up a dental clinic, to run it.
Why then can I go to Thailand or India and get the same level of care for a quarter of the cost?
Very low regulatory requirements, very low cost of materials that may or may not necessarily be accepted or approved here in New Zealand. So we have really high standards that we have to abide by here in New Zealand, and that unfortunately comes at a cost.
Okay, are they too high? Could
I don't think so.
Could we deregulate some areas? I don't hear a lot of complaints from the people who are getting their teeth done and their work done in India and Thailand.
You don't. We do in the front line. So we treat quite a lot of people that come back from overseas. Some have exceptional work, but quite a number of people come back with very complex problem. It would have been much cheaper to have the treatment done in New Zealand, even though it's expensive here. So I wouldn't say let's deregulate. I say let's actually look at the problem and try and invest in the right areas so the right people who are struggling to access the care can access it when they need to. Yeah. Sean, at the moment, hundreds of thousands of New Zealanders are accessing regular dental care in private clinics right across New Zealand, and they're paying for it, and they're receiving exceptional care.
Yeah.
So this is not a problem that's affecting every person.
And I recognise that you are providing a service that is good and works. But I tell you what, I was talking yesterday, I'll give you a real-time example. A mate of mine, he's well off. He's worked his whole life. He's just retired, or he's retired recently. He goes in to get a bridge and a couple of fillings, and he's $6,000 down the hole.
Yep.
And he says, I do not know. He says, I'm pretty well off. I don't know how anyone could afford that for their kids or anything else. And you said at the very start of this interview, we have an affordability and an availability problem.
Absolutely. But if your mate ever needed a hip replacement, would he complain as well? No, because it's funded. So we have absolutely no funding for anyone who's not on a benefit. Very little, unless they're children under 18. So that's why I said we need targeted funding to support people who are unable to access the care. As for your mate, if he is well off, should he be funded now, or should we focus on people who are absolutely unable to access the care and work our way up so more people can have targeted funding? So that's what we've called for all along. So we're not saying no one should get funding or subsidies towards their dental care. We're just trying to work our way through.
What about a suggestion, and someone texted me in earlier and said it used to be your position that we should raise the age of eligibility for state-funded or subsidised dental care to, say, 25, from 18 to 25.
Yeah, well, we advocated for that a few years ago, based on the fact that adolescents are staying at home for longer. They're undergoing qualifications, tertiary or trades, and they're usually unable to enter the workforce and start to earn for themselves until around their mid-20s. So we recognize that just because free dental care stops at 18, people don't magically start earning a reasonable living to be able to afford dental care. So we basically come out and said, look, we think there's a real benefit to be gained here by expanding dental care into sort of the next 6 or 8 years beyond the age of 18.
Okay. Look, the other thing, and I'm going to stick it on you, I look at, and maybe it's not similar, opticians need to be pretty highly specialised in terms of testing eyes and everything and providing prescription lenses. They used to be horrendously expensive in this country. They were, I think, a rip-off as someone who's worn glasses their whole lives. Along comes outfits like OPSM and Specsavers, and suddenly glasses are affordable. Is the problem here that you run a closed shop, Mo? That the dentists who are dentists and have jumped through all the regulatory hoops then just rob us blind?
Well, here's the question to you, Sean. If you're getting glasses, is anyone operating on your eyes?
No, they're using equipment and knowledge I don't have to test my eyes to ensure I get the right glasses. And I do have my eyes regularly checked for glaucoma and floaters because I'm diabetic, so I have, and I have dye, put them in stuff like that.
Good. So they're doing examinations, they're doing testings, and they're ultimately fitting you with a prosthesis, an eyewear, glasses. So put that into the context of a dentist. An examination, yes. A test, yes. A prosthesis if you needed a removable plate or something. Yeah. But if someone's drilling into your tooth or extracting a wisdom tooth and doing surgery, you can't. We're not comparing apples for apples. You're actually comparing someone who's undergone a medical qualification to become a dentist and is able to. So, no, I think it's probably quite an overreach to say we're
what you're kind of selling me is how incredibly talented and highly qualified you guys are. Compare yourselves to a doctor, to a GP then. What do you say? Are you surgeons? Are you all brain surgeons? Because it would strike me then, okay, let's just put you in the health system.
Would you want to?
I wouldn't. I probably wouldn't mind it, to be honest. It seems like a good idea.
And how would that help you?
It would help everyone because we'd have better dental care and more people would go to the dentist. And it is the one thing. I could not believe the volume of calls and texts we got yesterday from people who say, and maybe it's a cultural thing in New Zealand, the people who said the one thing that goes because of cost in terms of primary care is going to the dentist because it is so bloody expensive.
Take me back to what you said. So you said we should all be under the public health system.
Well, I'm just saying that would in a perfect world, We would have the same entitlement to governments, and it's not free. It's government subsidised or if you like, socialised dental care as we do other health care.
So are you in principle agreeing with the Green Party policy?
Yeah, with the outcome, absolutely. Not without to
You
get
are.
there. Yeah.
Okay. So we're not in disagreement. We're not in disagreement at all. We recognize it's expensive. We've just questioned whether we've questioned the sustainability of funding this particular policy. But we're absolutely
And I'm
not
also
against.
wondering whether or not more competition and regulations that were more friendly to competition, to more people becoming dentists. And I'm talking things we talked yesterday about, maybe paradentals, right? And it's like practice nurses in medicine itself, right? And paramedics.
What would you like the
People who are qualified to do a filling but not to do a root canal, right?
And what would you like them to provide for you that a dentist is too expensive for?
Okay, just a basic filling.
Okay. We
Dental
have that.
hygiene and stuff. What I'm saying is you
have
guys, look, Mo, I don't think no one is going to come to your defence if you say we don't charge like wounded bulls. In the context of the average income in New Zealand, you guys are bloody expensive, and there's no way you can get away from that. And if we've got a system that says we've got no choice to make except that you're bloody expensive, why don't we change the system?
We haven't questioned that, actually. We're open to us exploring other funding models. We haven't ruled that out.
But I'm also
we
calling
recognise
other
it's expensive.
systemic and structural things. So, as I say, not every dentist who can perform basic dentistry needs to get to the level of qualification that costs as much as your full-flown dentist. We've seen that in medicine. We've seen that in other areas. Maybe you guys could look at the structure of your industry, recognise that it's prohibitively expensive, and work in more creative ways to creating a system that gives us more available dentistry and more affordable dentistry without the taxpayer dipping into their pocket.
So you're saying we as a profession should lead the change?
I'm just saying you've got to be part of the solution, or otherwise you're just the problem.
Well, you're absolutely spot on, because come 2 weeks' time, we're going to be at the Beehive hosting a sector-wide summit talking about this very issue.
Okay, I didn't know about this. Okay, so tell us who's taking part in that, Mo.
So everyone who's in oral health and dentistry, all the unions, all the colleges, all ministers, all politicians, all the health system.
So you got all the parties are going to this?
Not all. Some unfortunately have declined.
Okay,
but,
which ones have
They've
declined?
all been invited. ACT have unfortunately declined. The Maori Party have unfortunately declined. Waiting to hear from National. So it will be really good if they can all turn up. Because
Okay, now
like
I'm just
you said,
waiting to hear from National. So in the middle of an election campaign, this is organised by you guys?
yes.
Okay, and who said you could use Parliament? How did you get into Parliament?
We asked, and they said yes.
Who did you ask?
You fill out a booking form. You can hire out Parliament spaces.
Okay, so you just
we're
went
going to
there.
be at the Beehive.
Okay, so this is cool. So what date's this?
It's the 24th of August.
24th of August. Now, I just want an assurance from you that this hasn't been jacked up with one particular political party in mind. You're not in cahoots with the Greens or
No, this is not a
Labour?
political event. No, the minister is opening the minister is opening the day, but this is the current health minister addressing where this current government stands on oral health.
So you've got
but then we've got a
all
lot
sorts of
invited
people
speakers.
from the oral health industry, let's call it a sector rather than industry.
Yep.
Have you got consumer representatives there? Are Consumer New Zealand going to be there?
No, not that we've thought about it, because, well, you've just called us to solve the problem from within.
Yeah.
You're welcome to attend.
Oh, excellent. Media are allowed. Look, this is quite exciting, Mo. This is quite exciting. Because I was sitting there thinking last night, do you regulate? Do you throw taxpayers' dollars? No, you've got to change the system. And to do that, you've got to get everyone together, sit down and say, what's wrong with it?
Sure.
What's the best way to improve it?
I'll just bring your attention to one thing. In 2018, our profession recognized this as a significant problem. So we actually commissioned a policy document from PwC at a heinous sum to the profession. And what we did with that policy was gifted to the government and to opposition. Now, you remember in December last year, the special needs grants from work and income went up from 300 to 1,000. That is because of a policy the dental profession, the dental association, commissioned and gifted to government. So I think we often get portrayed as the bad guys, which is quite unfair. But we would like some recognition that we as dentists recognize there's a problem. There are thousands of us working out there really hard, subsidizing policy so government can influence change. Now, for every person listening to your show, if they've ever had a grant from work and income in the last 6 months, and that grant's gone up from 300 to 1,000, they ought to thank their dentist, because their dentist paid for that policy to be before politicians.
All right.
So we campaigned for 15 to 20 years for community water fluoridation to be introduced, and again have paid hundreds of thousands of dollars in advocacy fees. And we saw that change come into legislation last year. Why? Because we recognize community water fluoridation is the most proven way of reducing dental disease. As a profession, we have a really high social conscience, and we have over the decades. We've been around since 1905, Sean, so we've been around for a long time. And it's written into our rules that we have a mandate to advocate for the population and for the public. Now, we can only do so much without political traction, and we've had some in the last few years, and we recognize change within oral health is only going to come if you have cross-sector and cross-politician buy-in, right? So we recognize...
That's a pity that ACT, the Maori Party and So Far National haven't said they'll take part. I think
hopefully they're listening to your show and they'll change their mind.
Well, I think they're missing a trick. I look at issues that really affect people in the street, and this clearly is one of them. Hugely.
It does. It does. And we absolutely recognize that. And we recognize we as a profession have a social obligation to lead the voice of oral health and to try and change the way we do things. Change is not going to happen overnight. So to you and to anyone listening, if they think it's a magic switch and you can just switch it on and all of a sudden things are going to be cheap, it's not. Look at the health system.
I don't want it to be cheap. I want it to be affordable.
Good, and so do we. So how about you turn up and you help us find a solution?
All right. Look, we will come along. How long does it run for, Mo? It's on
from 9 a.m. to 4 p.m.
And it's just for the one day?
Yes.
Look, I'm going to try. I'm going to try and get down there and have a talk and meet some people. And if I get a chance to say to anyone from ACT, the Maori Party or National, you should send someone as well, I will say send them. Look, the other thing I want to end up, and it was really funny yesterday, we had a lot of calls and a lot of texts on dentists. We've also in this country, and I wonder if this is an international trend, I suspect it might be, or people of a certain age, and around my age, in my late 50s, we grew up with the dental nurse, right? And there were permanent dental nurse in the primary school I went to, and it was everyone called it the murder house. And there was a terrible prejudice against dentistry. It was evil. It was something to be feared.
I can sense it in your voice, Sean.
and I wonder if does that still exist? And do we need to change that? Yeah, it does.
Well, absolutely. Not a single day goes by that a dentist doesn't get told, I hate you, but don't take offense, or I've been to the murder house. So there's a systemic problem we have in the way our profession is perceived. And let's face it, not many people go into the dentist willingly. A lot of people fear it, are anxious about it, they expect pain, and unfortunately it's just part and parcel. But we have an incredible profession who's so committed to providing regular care, relief of pain, but don't vilify us on the media by calling us greedy or robbing you blind, because we're not. Dentists have to run small businesses, Sean. You should know better than anyone. Running a small business is not cheap, and you're always hung out on the dryer because you're trying to make a living and pay for yourself. No, so we need better funding so people like yourself and other people who are struggling can access the dental care affordably. So what we've said about this policy, and I'm just circling back to what the Greens have said, we know 40% don't go at all. 40% of Kiwis don't go to the dentist at all because of cost. Yeah? The other 60% may choose to go or choose to not go because they're anxious or because they haven't got a dentist handy or they have got childcare issues, etc. But let's start with the 40%. So why fund everyone for free if you can have a targeted approach? If anyone's putting this off because of cost, let's support them. If anyone is struggling paying all of the cost, let's try to subsidize them, not pay all of the cost. So that's what we've tried to say. It's great when absolutely kudos to the Green Party for getting this conversation started because, like you said, a lot of people are really hurt. And this is no longer something that's affecting low-income households. This is now a problem, thanks to inflation, that's affecting middle New Zealanders. And that's people who are earning a good wage, mom and dad, 2 kids, and they often have to decide, do I get a root canal and a crown, or do I take the kids and the wife on a holiday this year? And they often have to take the tooth out because they still want to take the kids. So this is not actually just an issue that, low-income households are struggling with. So we recognize that. And believe me, as a dentist, working as a dentist, it's frustrating hearing that all the time and feeling helpless. You can't offer free dentistry to all as a clinician because you've got a business to run, and we've got mortgages to pay as well. But we want to be a part of the solution. We just don't want a solution dumped on us as a profession that's not going to work or is not cost effective, or for people to belittle our profession. I mean, you're talking about a paradontist. Why do that? You've already got a really well-trained profession. You've got other oral health therapists, dental hygienists.
We don't seem to have enough, Mo. As I said, I tried to make a dentist appointment yesterday in Wellington, 4 different places, nothing available for 3 to 4 weeks. I mean, what's going on?
Why? Because as a country, we only make half of the dentists we need every year.
Okay, so it is training. It is getting more people through,
Absolutely. And what happened when we were on lockdown? We had closed borders for 2.5 years. So for 2.5 years, we had no one coming into the country. So we're behind quite a significant number of years. So one of the things we've said about this policy is, look, we recognize there's a problem. Workforce is a huge issue, but don't go out there promising that it will change next year because it will take a long time to remedy the workforce. So that's why, again, I go back.
Okay,
targeted funding.
Yeah, look, this has been a really good discussion. I got one last question for you. What do you say to people who are listening, and I've had lots of texts from them, who are saying I'm going to Vietnam or India or Thailand in the meantime to get my teeth done? Okay, go for it. If you know the place is reputable, we actually have a brochure that's available, and I'll gladly get our comms people to send it through to you. On tourism dentistry, we warn against it because people who go into unknown places end up having subpar treatment in some places in the world and come back to New Zealand with more expensive treatment to make. And we've seen it all the time. Less so because less people had traveled during COVID, but it's making a comeback and we'll be seeing more and more of it. So do it at your own risk, but be warned, if you come back with implants done overseas that are having problems, people in New Zealand are unable to fix them for you because they're not necessarily things that we work with. So people who travel overseas to get dental treatment can often end up paying more in the long run because they chose to go somewhere else. All right. Hey, Mo, that's been a really good discussion. I thank you very much indeed for your time this morning, and I look forward to the 24th. I think all political parties should go along, and good on you. Thanks for fronting.
Great. Cheers, Sean.
Cheers.
Bye.
Dr. Mo Amso, he is the CEO of the New Zealand Dental Association, prepared to box his corner, highly qualified. He says, I don't know that I bought everything that he was saying, but he gave us the dentist's point of view. What do you think? I thought pretty aggressive against the overseas treatments. Someone says there's subpar treatment here too. I'm sorry, I'm not going to put dentistry up with brain surgery though, Mo. I don't think they are the same things. Really, really interesting discussion, and gosh, it took up the whole half hour, but that's okay if we're having a good discussion. I agree, Sean. I agree with the Green Party dental policy to a point. However, it's hard enough now to get an appointment. So I'm thinking of suddenly there's no through the door cost. You're going to get every Tom, Dick, and Harry lining up, and we end up like the health system where it's struggling. And people are waiting too long. I'd also like to know if there are going to be race-based priority or income-based priorities here. Okay, good point. Mo was pretty good, said Hugh. Yeah, I think he was articulate and he argued his point well. I want to hear from you. I want to hear from you if you've gone overseas for a dental procedure and had it go wrong and had to pay more back here. That's what he tells us that happens. I haven't heard anyone with one of those stories yet. And Dave said at least he fronted, yeah, and I give him that. So we're into an interesting and I think important debate that matters to a hell of a lot of New Zealanders. So that's what the platform, what the platform really is all about. So thanks, Dr. Mo.